My name is Kathryn Smith. I am the Medical Director of Pediatric Liver Transplant here at Johns Hopkins. I'm here today to talk to you about a case that my team and I presented at the NASPGHAN 2023 National Meeting in San Diego, California. This case involves a little girl who was 14 months old that presented with jaundice, abdominal distension, malaise, intermittent fevers, and emesis. She was found to have labs significant for elevated liver enzymes, with her ALT greater than 4,000 and her AST greater than 7,000. Her INR, glucose, and albumin were all normal, indicative of normal synthetic function. She was admitted to our service, and we worked her up with a working diagnosis of a viral infection with acute hepatitis. We did obtain a liver biopsy, and at that time, the liver biopsy was significant for acute hepatitis without any clear findings of any other diseases. In the meantime, her laboratory work came back with a positive ANA, which is a nonspecific marker, and a positive liver-kidney microsomal antibody. This antibody is seen in type 2 autoimmune hepatitis, which is an autoimmune hepatitis that is more commonly seen in kids and is known to be more severe and harder to treat. At this time, we decided to go ahead and treat her with IV steroids for induction treatment of presumed autoimmune hepatitis type 2. Her numbers did respond and improved, but they did not normalize. And so the decision was made to add on CellCept as a steroid-sparing agent, and eventually we added on tacrolimus as well. In the meantime, she was evaluated by the genetics team who sent whole exome sequencing. This sequencing returned with a variant in the STAT1 gain-of-function, a de novo mutation. STAT1 is part of the JAK pathway, which is the immunomodulating pathway that involves many different organs. With this mutation, we found out that she was at risk for immunodeficiencies in many different organ systems. At the time that we diagnosed her, the only organ that was affected was her liver. And we did do some investigation for other organs, but we have not found any other organs involved at this time. The decision was made to put her on a more targeted therapy since we now knew she had a STAT1 gain-of-function. We sent authorization for a JAK1 inhibitor for her to start, which she did start, and she continues now on JAK1 inhibitor in addition to CellCept and steroids. Her liver numbers continue to improve, and she is now living a happy, healthy life. Eventually, she may need a stem cell transplant, but in the meantime, we are hopeful that we can keep her disease under control with the current medication regimen. This case is unique and represents new and exciting opportunities to discover if there are immunodeficiencies underlying autoimmune hepatitis type 2 in very young children. I would like to thank the NASPGHAN Foundation for allowing us to present this work at the annual meeting. In addition, I would like to thank all the team members who are instrumental in getting this child diagnosed so that we could find a treatment so that she could have a normal childhood.